Now, Health Minister Dr. Zweli Mkhize is cracking down on surging COVID-19 cases in the Eastern Cape. The Nelson Mandela Bay Metro in particular has seen over 400 new cases daily for the last while, prompting concerns. About 140 healthcare workers have also tested positive for the virus in the last few weeks, adding to the strain on the Eastern Cape's health system. Now, the minister says cluster outbreaks will have to be identified and more Cuban doctors will also be deployed to the province. For more on these strategies and on our COVID-19 response in general, we're joined now by Health Minister Dr. Zweli Mkhize. Good morning, Minister. It's always great to talk to you on the show. Great to have you with us. Perhaps let's just begin, Minister, with your visit to the Eastern Cape. We saw some photographs on social media yesterday of one of the hospitals you visited. What did you find there?
Well, thank you very much, Michelle, and all the viewers. We have visited the Eastern Cape mainly on the basis of the report that we have been receiving, which were showing that there's a resurgence in the number of cases. We have been to the various hospitals, and in discussing with the clinicians who are managing the situation, we have actually confirmed that the number of patients that they are seeing in hospital has increased. The number of people who are testing positive has obviously increased. The number of people who are dying in the process is starting also to increase. And the number of people who are positive per 100 patients, which is a positive case percentage positive, is increasing. It moved from about 10, which is where we were when there was the plateau, and now it's gone back to about 27%, which is where we were during the peak. So by all counts, this is an indication of a huge resurgence in the area. The staff are feeling it and the community are feeling it.
In terms of, yes, Minister, that was my next question. The hospitals and the strain that I'm sure the hospitals will also be under as a result.
Certainly, there is a strain that they are all feeling. They have reported to us, firstly, that there is exhaustion and fatigue on the staff, mainly because it's the same staff that was, on duty before the surge and then during the surge. And so at this point, they are feeling the strain, and we have to put in some measures to deal with that. Then the other issue that they were raising was the fact that there's a pressure on beds. And when you say pressure, we mean that there are areas where you will find that the beds are full in this hospital, but in other hospitals it's not full. So now they've got to work out a mechanism of redistributing the patients so that they move the patients to where the beds are. That's another area of a strain. In some of the areas, the numbers of patients that require ICU go to an area that does not have the ICU, and therefore they've got to now, convert some of the areas to put them into a kind of high care capability. And so that has been the issue. I think what has been most useful is the fact that we've been through this path before, so there are lots of lessons. People know what they must do, and that the numbers of beds are being increased in a number of hospitals that I've been to yesterday. They are actually part of the old projects where we decided to convert and refurbish old hospitals and create new wards, and so that is now coming on stream. And oxygen connections have actually been extended to more people, because now for us, oxygen is the first line of treatment. It also is the main line of treatment even when people get to the ICU. So in that way, that we're seeing that there is a response that is adequate for the situation. We have not run completely out of bed globally in terms of the district, but what we are now doing is to improve the capacity in the laboratory, so that the patients who are under observations, who are being tested to know whether they're negative or positive and are admitted with symptoms, don't stay too long there, because that's what puts a lot of clogging of the system.
Yeah. Minister, we talk about the strain on our hospitals, the strain on how many beds we have available. Let's talk about the emotional strain of our frontline workers, Minister. As ordinary citizens, we are already, we talk about pandemic fatigue. We're all tired of taking all of these precautions. What about our frontline workers who really every day are faced with more and more patients who are dying, patients who die, colleagues who die?
That's a real issue. The issue of fatigue is a big problem. To start off with, the fear of getting infected was a major problem when we started, people not knowing that you'll go to hospital, treat the patients, and go home and infect your family. So that was why we had to take a very strong stance on the issue of PPEs to say ultimately no PPEs, no work, because they must be protected. The level of information is important so that people don't panic when they deal with the viral infection. They need to go there with the understanding that they've got the power over the virus. And once that is sorted out, it helps quite a bit. And thirdly is the issue of supporting one another. People need to be able to get rest. They need to be able to give them time to, get shifts so that they don't work extremely long hours. The organization of work has to be sorted out so that people don't get to do more than they should be doing simply because it's not well organized. But the fear, the fatigue, there's nothing as big as the anguish of waking up in the morning, going to a ward, patients are very sick, and some of them are dying, and all they have is you as a professional there. They don't have their family because they can't call them, they can't be visited, they can't tell them their concerns, and they can't tell, the pain they feel. They have to only share with the health workers, and they carry this. And this is actually a real issue that we're attending to, because the distress comes from having to absorb all the pain. The question, and then this is how we used to call it, they are supposed to be there to comfort the patient, care for them. And the real issue becomes, how do we deal with the comforting of the comforter? And that's really where our biggest strain is. And the issue is, they must always, as health workers, be ready to carry the next load that's going to come. Yeah. You walk in, there are patients being taken out because they are sick, some have died, and now you have to tell the family, you have to sit down with the family and counsel them, and all the emotional distress comes back to you. It's really not as easy. And I think we must all, get our hearts out there for all our health workers.
No, we owe a great debt of gratitude to all of our frontline workers. Minister, in terms of our response as a country, months now into the pandemic, a few months ago, there was the issue of high-flow oxygen being a sort of new way of treating patients before they were going to be put onto ventilators. What are some of the other new ways that we've perhaps discovered, Minister, over the past few months of how to deal with patients who have severe cases of COVID-19?
Well, I can just say to you at this point that I take my hat off for South African clinicians. They have learned, they have researched, they have clear regimes of how to treat these patients. And therefore, anybody who is sick, you go out there, people know what to do. And from that point of view, I'm very comfortable. But certainly what they have to end up with is the oxygen needs to be available immediately, because the first thing that you check is whether the saturation of oxygen levels, are they showing a decrease or not. Once they show a decrease, you need someone to have an oxygen supplement, and they can actually recover without needing any further treatment. But if they need further treatment, you have heard, of course, about the corticosteroids. Dexamethasone is one major issue that goes in there. This comes on top of all the other antibiotics or antiviral agents that are being put on. And what we have found, of course, is that availability of oxygen particularly is what helps at the beginning right up till the end. And therefore, we have now been installing oxygen tanks all over. And during this peak, we had unprecedented cooperation, even from the companies that distribute this oxygen. They've been called out to small hospitals where they've never set up any tanks. They've put them up there. And so we've got, no hospital that should be unable to provide oxygen as a first line of treatment.
Yeah, as we talk about treatments, Minister, two big stories coming over the course of, over the course of a week, the issues of these vaccine breakthroughs in the US from Pfizer and from Moderna. How do we here in South Africa read those stories as a positive story for our country and for our fight against the virus?
Well, as you have heard the President indicating, as a country, we have tried to keep ourselves to be part of what's going on globally. Now, firstly, there is what we call the COVAX facility, which is part of the ACT Accelerator, which is really access to COVID-19 tools. And that program we are part of the nations of the world that are pooling resources to try and make sure that at the end we can actually make resources available to procure the vaccines that have been proved to be efficacious and successful. So we are part of that process. On the other hand, we are having some discussions with a number of companies. Now, we have heard about the Johnson & Johnson. Yes. They've had an agreement with Aspen to create capacity in South Africa, technology transfer, manufacturing capacity, so that when they are successful, we could actually get some of the manufacturing taking place in South Africa. They are looking at that happening sometime in the middle of the year when their trials have run their course and have been proven successful, and there's been registration, and hopefully by then we would have been able to get registration in South Africa. The second one has been pioneered by the Pfizer Group. They have teamed up with BioVac in South Africa, which is an entity that's linked to government as well. Now, again, technology transfer, and the idea is that when they are able to register their vaccine and they are able to start producing, South Africa will also start as part of that whole network to manufacture. Now, they are hoping to get the vaccines, the trials concluded by the end of the year. So we will wait and see when they are actually registered with the FDA. So at some point, therefore, we should be able to participate. In other words, therefore, there's another one which the president has also started working on, and that is access to vaccine by the African continent, the AU-based program. We're working on that. Again, they are making approaches. We will go for what works quickest, best, and most efficient for South Africa.
I know I'm going to get this kind of backlash on social media, Minister. You don't have a timeline for us. You know, in the US, they're already talking about doing large-scale trials in certain states. I think it's 3 or 4 states in the US. That's going to happen towards the end of the year. Well, we are already at the end of the year. It's meant to happen in December. You're saying if we're going to look at vaccine manufacturing taking place and being available here, more likely June next year?
Well, let me put it this way. Firstly, we are part of the trials that are going on globally. So when we talk about the trials that's being done by Pfizer, that group of trials, we have links with them. We've got links with the Johnson & Johnson trials. Now, it is not going to be South Africa behaving as though we're running our own show. It's part of the same network. Now, the nature of the trials are such that on the Pfizer group, they are actually using what is called messenger RNA technology, which is different. And so they think that they might be able to move quicker. That's why they're talking about December as the point at which they could have finished some of their trials and therefore go out and go seek registration. It needs to be registered in the US first. Then, based on our own trial, they will then approach our regulator in South Africa, and then there will then be a registration. Then you can move on. But at the same time, the technology transfer would have happened as soon as the particular companies are able to get that to happen. So we won't really be lagging too far behind any other countries. The same with the Johnson & Johnson. Their trials are likely to finish around probably March. And in our case, you can only do registration thereafter. And then sometime towards the middle of the year, there will probably be production. So these timelines are not South Africans only. These are timelines that are for the major companies.
Yeah, absolutely. Minister, as always, a great pleasure talking to you this morning on the AM Report. That's all the time we have for this morning. Thank you for making yourself available to us. That's Health Minister Dr. Zweli Mkhize.